during your EFR, probably training ninyo, pag school days ninyo, one of the emergency procedures is a CPR na siya. Now, the problem with CPR is, especially during EFR, the procedure is very long. At the same time, it's very well detailed. But during the assessment, we have to make sure that it's easy for us to memorize the sequence of the CPR. Okay? So the procedure that I have here is simplifying it so that it will be easy for you to memorize and also demonstrate the procedures in CPR. Before, the EFR is very long. Actually, that's the right way in performing the CPR, the correct procedures. But on the assessment day, we have to save time as an assessor. So how do we save time? We have to shortcut the sequence or the procedure of CPR. Okay? So the first procedure is check the scene. So during the assessment, one-on-one, there will be assessor and one candidate. The candidate will be the one to perform the CPR okay? So you have to talk all the procedures and step-by-step procedures for the CPR. First is, you will talk in front of your assessor. So hi, my name is, there is always introduction. I'll be performing CPR for adult or for child or for infant. Then the assessor will tell you, can you perform CPR for adult? Okay, I will start performing CPR for adult. First is, check the scene. If the scene is safe, I will continue with the emergency procedure. If the scene is unsafe, I'm going to transfer the patient to the safe area, the evacuation area. Second is BSI on or wear PPE. You make it simple, you can actually tell the assessor, I'll wear PPE. PPE includes medical gloves. You have to wear gloves during the procedure of CPR. So you have to bring gloves. Okay? Then after that one, approach and introduce yourself. Okay? So you will kneel down in front of your dummy na siya. Then, so kneel in between sa shoulder. Kneel in between sa shoulder ni patient na siya. So that it's easy for you to check on the head part and also perform a chest compression on the chest of your patient na siya. Yes, and then introduce yourself. Hi sir, hi ma'am, I'm Prince, trained first aider. Can I help you? Or kung sa Bisaya pa, sorry, I'm speaking Bisaya. Okay. Hi sir, hi ma'am, basi niyang naiubad sa inyo mugamit o Bisaya na language. Okay. Hi ma'am, hi sir, ako din si Prince, trained first aider. Pwede ba mo tabang nimo? So you have to talk in front of the dummy na siya. You will also talk if you have a child na dummy na siya. Talk to the dummy. If you have an infant dummy na siya, do not talk in front of your infant, but talk to the guardian or the parents na siya. Usually, the assessor will just act like a guardian na siya. Okay? Hi mom, hi sir, I'm Prince, trained first aider. Can I help your baby? Okay, that's how you introduce yourself if you have an infant na patient na siya. Okay? Now, let's continue. Next one is check for responsiveness. How do you check for responsiveness for adult? Okay. Adult and child, we have hey, are you okay? Hey, are you okay? That is for adult and child. Okay. For infant, how do you check for responsiveness? Using the Babinski reflex. Okay. So you have to create a J motion sa iyang feet or below sa iyang feet na siya. If the baby is responsive na siya, usually the baby's foot kicks na siya. But if the baby is unresponsive, there is no reaction or movement to their feet na siya. So meaning unresponsive or unconscious si baby na siya. Gets in you? Now, if they are unresponsive, then you will ask for help. Okay? Help, pwede mo mutabang sa kuha. Okay? So after asking for help, check for pulse and breathing na siya. Now, for the checking of pulse or breathing, ayaw na to gamit na itong left, itong look, listen, and feel na procedure na siya. You can just actually check on the pulse and look at the chest of the patient. Okay? But during the assessment, okay, there might be some assessors, karaan na mga assessors who are still using the look, listen, and feel na procedure na siya. So when we say look, you are going to look at the chest. When we say listen, you are going to listen to the breathing sounds sa your mouth and nose na siya. So closer ang inyong head. Then when we say feel, we are going to feel the carotid artery na siya if there's any pulsating force. So count for how many seconds? 10 seconds. So 1001, 1002, 1003, 1004, until 1010. Okay, then you will see negative pulse, negative breathing. Okay, activate EMS or call for ambulance. You can ask the assessor, Sir, ma'am, palihog ko tawag ang ambulance or can you please call ambulance and come back to me for any updates na siya. Then I will begin CPR. You have to talk each of the procedures before you perform chest compressions na siya. Gets in you? Then when you start CPR, swerte-swerte ni siya. Okay, when we say swerte, lucky if you have the dummy na walay lights, there's no lights. Okay? If there is lights, good luck. Why? Because it will tell you whether your chest compression is correct or not na siya. Okay? Now for adult, it should be two hands. Your dominant hand will be on the chest, the other hand will be the lock or support na siya. Okay? If you have a child dummy, one hand. Okay? If you have infant patient, fingers, you can use your fingers as well. Gets in you? Yes, alright, so let's start with adults. Okay? Let's count all together. Ready? Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 1. 9 and 1 because it's your first cycle. You have to remember that counting. Now, also, when you start chest compression, you have to shout the numbers. Do not think of the numbers or count the numbers in your mind. You really have to talk the numbers here. Like 1, 2, 3, 4. This will also help you give pacing in CPR. Because if you just think the numbers in your mind or count the numbers in your mind, tendency is mapaspas mo 1, 2, 3, 4, 5, mo-orange yan. Okay? Or what if when you compress, okay, dili kay deep ang inyong, for example, compress na ko sa dili na deep. If it's no longer deep, it will be red. Okay? Make sure na when you perform chest compressions, it should be deep yun na siya. Use your upper body yun na siya to perform chest compressions. Gets in you? So when you practice soon or later this afternoon, make sure to practice this kind of dummy na siya. Because ABQ has dummy na mo, siga. But ABQ also has dummy na without lights na siya. So swerte-swerte na siya. So you're lucky if there's no light na siya. Okay? Pero na ko gitudlo ani gahapon, I taught my students the groups gahapon na if in case the dummy ala ka mo siga ang kuan, okay? Slowly remove the battery dire. Ano mo battery dire? Na joke. Ayaw ito niya kailangan baterya. Okay. Now, sorry. So that is for the chest compression. 30 chest compressions for your adult. For child, one hand. For infant, it's also, it's fingers. No, you can either use these fingers or you can also use the fingers. Okay. Then perform chest compression. 1, 2, 3. The same pacing or counting yapon sa adult. Gets in you? Okay. After 30 chest compressions, then perform 2 rescue breathing na siya. So what do we do with rescue breathing? So before we do rescue breathing, we have to perform head tilt chin lift maneuver for adult and child. So how do we do with head tilt chin lift maneuver? One of our hands will tilt the head na siya, then the other hand will lift the chin na siya. So that this will help open the airway. Pinch the nose, then provide 2 rescue breaths. Okay. Okay. Then after 2 rescue breaths, continue with the chest compressions for second cycle na siya. Gets in you? Now, there are some scenarios that assessors will tell you. What if, when you give 2 rescue breaths, the air didn't go inside to your lungs, or there is no rise and fall, or the air creates a backflow. Ibalik ang hangin na imong gihatap. What do you do? What do you do? Continue CPR?
Stop.
What do you do if in case there's a backflow pag providing you sa air?
Stop.
How do we make sure that air will enter to the lungs? What do you do?
Lift.
Huh? Okay, or I'll rephrase her answer. You have to re-tilt the head. Di ba earlier we lift the chin and tilt the head na siya. So if ever when you breathe the mouth of the patient and you've noticed that there's a backflow immediately, then re-tilt the head of the patient. When we say re-tilt, we return back the head to its original position and then perform again the head tilt chin lift maneuver. This is to help reopen the airway fully na siya. Then provide a rescue breathing. Okay? Now when you provide breathing, it should be 1 second prolonged of air nila siya. Do not provide air so may move. So why musud hangin na? It should be
So sa assessment sir, sa dami ito,
yes, you have to mount yun na siya. But in reality, the American Heart Association recently posted the latest 2022 CPR. You're no longer allowed to perform mouth to mouth.
pero pwede ka itong gamit na itong.
Okay, another one. Okay, you're not also allowed to use pocket mask anymore. Why? Because of the COVID. You'll never know this patient is positive sa COVID. And even if you use barriers like the pocket mask, problem with pocket mask is it doesn't have any filter or barriers to protect you. So when you breathe in, there are some airs that might exit while you are breathing in as well. So you might acquire the COVID virus as well. Okay? You should be using the bag valve mask device. Are you familiar with it? Remember what was that one? Oh. Kato na. Why? Because sa device naman to siya. Pero the bag valve mask device should also have a HEPA filter. When we say HEPA filter, that's a filter to capture the virus na siya, any virus including the COVID virus na siya, before it enters to the bag valve mask device na siya. That's actually the new 2022 CPR na siya. Unfortunately, there's most of the assessors are not yet updated with the new CPR. So we'll just follow the old CPR kind of sequence na siya with kind of rescue breathing. Okay? So after 2 rescue breaths, then you will continue with the second cycle na siya until the assessor will tell you to stop na siya. Okay? Usually you will end about 2 cycles or 3 cycles there. That's it na siya. Okay? Also, you have to remember the dummy should be on the floor or hard surface na siya. Do not perform CPR on the bed. Okay? Unless if the bed is for cardiac arrest bed na siya or cardiac bed na siya. Meaning we can easily perform CPR on that bed. Okay? Tricky kayo na si assessor. They will test your skills if you really know how to perform CPR or not. Because if you CPR on bed, it will not work. Why? The body will just bounce sa foam. Okay? But if ever nasa hard surface, the body will not actually bounce. Gets ninyo? So if the dummy is on the bed, transfer the dummy to the floor na siya. Then, kunti ka na perform CPR. Gets ninyo? Okay? The same way po sa infant na siya. So it's 5 cycles and what? Oh, okay. Then 2 minutes na siya. Sir, question. Do we still have rescue breathing in the assessment? I don't think there is a rescue breathing pa. Okay, I've never saw any assessors asking their candidates to perform rescue breathing. But if you can still remember the rescue breathing, how many rescue breathing for adults?
24.
24. Okay, how about for infant?
14.
14 is it. You just have to remember those numbers because the assessor might ask questions this year.
Sir.
Okay, yes.
Regarding for 2 minutes, sir,